This conference will now be recorded.
I'm really excited to start talking to you about how to get your space COVID friendly, because this means we are at a time that we are definitely looking at reopening our businesses and getting our industry started again. So thank you so much for joining. We appreciate your time. I see that there is still some people joining, and luckily the session will be recorded, and so we can share with everybody that has missed some of it. So as Ilse Marie mentioned, my name is Ilse Erasmus, and I look after the education of our concept stores. And there will be two parts to this forum today. Our first phase is opening up in retail. So in other words, where we are able to get our space ready to be able to sell products. And the second phase is where we can actually start touching our consumers again and performing services. So I thought it really good to offer this in two phases as well. So today what I'm going to do is I am going to cover topics such as health and safety, what is PPE, what is the signage, what does it look like, your reporting, what records do you need to keep, what do I do when somebody is contaminated in my workspace, and of course share with you our toolkit. Our next phase will be in our next forum, which will be next Thursday, the 28th at 2 p.m., where we will discuss more in detail how we will get our spaces ready to start performing services. So we're not 100% sure when this will be, and I know that us as an industry have really pushed hard towards the government to not only open in level 1. So I think I'm very optimistic, and I'm really hoping that by June, we can actually start phasing in these type of services. But first, let's get ourselves ready and familiarized with everything that we need to know. So at length, everyone knows, I think, and is super full with all the information from COVID-19. I think we are overloaded with information. We're very familiar with what this virus is. We're very familiar on how it spreads, and we're very familiar that we need to be very careful. Now, the reality is this is going to be around for many months and perhaps years to come. We don't know. But as a lot of people refer to this is our new normal. And we're going to continue business unusual. Now, I think for us as professional skin therapists, we're very fortunate because hygiene has always been top of mind for us. And so it's not hard for us as professional skin therapists to add and implement additional precautions to make sure that we have a very safe, clean and sanitized space, not only for our clients, but also for our therapists. So let's have a look at what it means to be COVID ready. Now, when we refer to health and safety, this is especially for our employees and for our clients, because the health and safety of our employees and our clients are our #1 priority. And when we comply with health and safety measures, you will probably find that a lot of things will happen, such as we'll be able to control and limit the COVID infections. We will create a very productive environment because it's safe and sanitized. And you will find that absenteeism of your staff will drop because they are healthy. Now, a higher standard in workplace definitely allows for happier employees. And most importantly, this is very, very important for us to have a safe space for our people, because we need to protect our people. They are our assets, our employees. So eventually what will happen is we will win and we will retain more business, consumers, because we're such a safe and healthy space. It will enhance us as a brand and our goodwill. And of course, ultimately, this will reduce business costs and disruption. So as you can see, this is a very, very important part of our business and that we need to look at. Now, the World Health Organization, according to them, there are a lot of things that we need to do to assist us in complying and making sure that we are protected. So let's have a look at these things. Now, something that a term or technology that you might have started hearing a lot and wondering what it is, called PPE. It refers to personal protective equipment. Now, this is equipment that will protect the employee against health and safety risks at work. So when we say PPE, we're talking about the physical equipment that protects employees. Now, appropriate PPE needs to be worn by all employees based on their role, what they will use, and adherence to the guidance that we get from the government. Now, training on how to use the PPE is very important and also compulsory for you to do with your staff. Here are some pictures on the screen about what you can consider as PPE in our industry. Gloves, protective glasses, disposable aprons, protection boxes, these Perspex screens that you have seen, and of course the famous mask and face shields. When we go into a bit more detail on these, each employee needs to be provided with 2 face masks. It could be a cloth mask, or if you provide them with a disposable mask, you will have to provide them with 2 masks per day. They also need a face shield, and both of these needs to be worn when they are interacting with consumers every single day. It cannot be removed unless they go for their lunch and they are eating. And when they are managing and handling their masks and face shields, they need to ensure that their hands have been sanitized. The cloth masks would need to be washed daily in 55 degrees Celsius. And to clean your face shield, you will use your sanitizer or disinfectant that you have in your skin center to clean these face shields. Now, we also advise if any of your employees are taking public transport, that they would put their mask on the minute they leave their homes and that they would not travel in their uniform. Advise them to wear normal clothing, and once they get to the skin center, they would then go ahead and change into their uniform, place their clothing in a drawstring plastic bag and put that away, sanitize their hands, and then only apply the uniform and spritz their shoes with a sanitizer. This will ensure that there's no cross-contamination coming from a public transport. Another example of PPE is disposable aprons. Now, once we start offering services, we will go into a lot more detail, but I did want to list this here so that you understand that this forms part of PPE. Now, you get disposable aprons that you can use only once. You would apply it and you would roll it off after the service, and you'll place it in a closed bin with a lid. You can also use cloth aprons that are reusable and that would need to be laundered daily after every use of each service. We're very familiar with gloves. We have worked with gloves before, but at Dermalogica, we don't recommend the use of gloves to hold onto these gloves on a daily basis. So general, just day-to-day activities wearing gloves, we don't recommend. We do feel that hand washing and sanitization of your hands is a lot safer than wearing gloves. However, should the South African government and regulations for safety change this and tell us that we do need to wear gloves, we will adapt to that. And of course, if a client insists on doing the treatment with gloves, we will also ensure that we do so. But we will talk more about this topic in our next forum when we get ready to doing services. These Perspex divider stands have been rather popular. You would see them everywhere. And they are really good to create a physical barrier between an employee and a client. And this will really be good for cross-infection of this virus. You'll see there's different ones. There are ones that you just put at your point of sale or reception area, like you can see on the left. And then these are really clever ones that you can just put your hands through to ensure that you get your nails done without that cross-infection. At our concept stores, we have invested in a protection shield that is mobile, so we would place it at the POS area. And should we need to do a consultation on the client that's no touch at this stage, a face mapping that's no touch, we could place this at the skin bar as well to create that barrier. Now, other things that is not classified as PPE, but things we need to implement and consider, we're going to cover right now. And the first one is temperature checks. Now, checking your employees upon entry every day, but also rechecking in the afternoon is very, very important. It's also important to screen your clients when they walk through your door. Anybody, employee or client, that has a temperature of 38 degrees and higher is considered that they've got high fever or a fever. And you can deny entry into your space if that client has got this degree Celsius shown on the thermometer. You would also advise this person to maybe go to a COVID screening space where they can actually get checked out and self-isolation. There's a lot of designated COVID screening areas that you could ask them to go. So I would suggest you find out where is your closest one to your skin center and make sure that you can be in contact with them regarding this. Now, hand sanitizers are definitely not new to us as professional skin therapists, and we've been using this all along. We know that 70% alcohol should be the lowest grade or medical grade of sanitizer that you need to use, and you can't go lower than that. And it is advisable to use anything that's handless, so no touch sanitizers. However, there's different ones on the market. You do get a no touch one, as you can see on the left. These pedal sanitizers are very popular, that you would insert and you just stick your foot on it. And then you have your traditional sanitizer in a bottle. Now, we suggest that you have your hand sanitizer upon entrance into your skin center. We also suggest that you have a therapist upon the entrance who will greet the client and who will provide the client with the hand sanitizer so that they don't touch any of your equipment in your skin center. There should be a hand sanitizer not only at the entrance of your skin center, but have one ready at your reception area or your point of sale if you have a skin bar or a retail space, a nail bar, and any of your treatment or service stations that you have, including your canteen, cafeteria, or your staff room or kitchen. But these are available all across for your clients and for your therapists to use. I've got an example how we've implemented this in our concept stores. And as you can see, upon the entrance of each store, there is a plinth that is covered with signage that talks about COVID friendly. On top of the plinth, we have more signage, a hand sanitizer, and a thermometer. These are placed at the entrance because that's where they need to be used. And when you open, you need to ensure that you also display your CIPC certification and your COVID rules and regulations for entering the space. So this is just a nice example so that you can see how you can do that. Hand washing still remains, according to research, the best way to prevent any form of contamination. We know that warm soapy water for 20 seconds is very important when we wash our hands, and that hand washing needs to be conducted very regularly or at least every hour. We do suggest that the therapist washes their hands in front of the client if there is a basin available, before they connect with the client in any way, as well as afterwards again. When washing your hands in this manner, if you don't have a sink available, you would do a hand sanitizer instead of that. Social distancing is very important and needs to be kept at 1.5 meters. So this is the physical distance that we do recommend. We also recommend that you limit the amount of consumers or customers that comes into your spaces. So depending on the size of your skin center, you can decide how many people you would allow in. Now, for us at concept stores, our store space is typically on average 60 square meters, and therefore we have limited 2 consumers per store. We also consider that we will have 2 therapists on duty, so that will give us a total of 4 people. So just keep in mind the space that you have and how you would limit this. If you have seating within your skin center, ensure that you space your seating out to allow for this physical distance. And then, of course, when a client comes closer to make a payment at your point of sale area, ensure that you inform your therapist to move backwards to allow for the 1.5 meter distance. Don't forget your kitchen or your canteen or staff areas. What we've done in concept stores is that we have staggered their lunches so that no more than 1 person is on lunch at the same time. This then allows them for social distancing within the small kitchen spaces as well. Now, as a brand, we love our testers, and this is definitely a way that we get the client to try the product before they buy. So it's really hard for us not having our testers on display, but it is very important to actually pack these away. They so easily can get very contaminated, and we could so easily cross-infect. We suggest you take all your testers off your skin bar or your retail spaces, have them sanitized and clean, and close them into or put them in a closed container with a lid, or in a cupboard or a drawer that's closed. Should a consumer want to try a product, or you are doing a consultation suggesting that you should use the new Active Clay cleanser, you would then ensure that you stand across from the skin bar or keep your distance. Take out the tester that you want to give your client from the closed container. Let them try it themselves on their hands, not on their face. Give them the wipes to remove. Make sure that you put all of those items in a bin, the disposable items, and so she can play with the products. Once she's done with those, you would need to ensure that you sanitize these testers before you pack them in, and they will always remain clean in this airtight container. Now, our retail products on our shelves is also quite high risk. So in our concept stores, we suggest that we have lesser amount of products. So we have got all our SKUs, but we only have 2 of all our SKUs on display. This is entirely up to you, but we just feel that minimizing the amount of products that we need to clean is just easier, but also reduces the risk of infection. We also suggest that the clients don't touch your retail themselves, but that the therapist would handle all the retail on the shelf, from the shelves to this point of sale area into the bag, and the bag gets handed to the client. So no touching of the client touching the products is our suggestion. So remember, cleaning is very important. We all know how to do this, but it's important to have the right cleaning material, having the right disinfectant that actually disinfects, and the correct sanitizers are exceptionally important in your skin center. This is just a nice guideline for you to use if you are a little bit OCD like I am. And so this is a guideline that you can use to say that my cloths are these colors. You can have color buckets to ensure that your cleaning in certain spaces are limited, that you don't cross-infect. So red typically is for bathrooms, washrooms, basins, and showers. Your blue cloth with your blue bucket would go for general areas, department offices, basins, public areas, reception areas, all of those. Green could be for your kitchen, so anything that you're catering, your cups and coffees, etc. And then yellow is not something we would use because this would be for hospital and isolation. Also, try and hang up your cleaning material as in the picture on the right, and don't let them stand on the floor. I would also suggest that your clients uses their own cutlery by bringing all of this themselves to the kitchen or to work, and that they wash it straight after using it and pack it back for them to take it home again, because we don't want to share any cups, plates, and cutleries. We're also not going to serve any beverages to the consumer at this stage. So while you are complying with all these measures, make sure you shout about it to the consumer. Display through signages is a great way to showcase the clients that you're a safe space to enter. Now, we at Dermalogica have designed a number of different signages that you can use, from display sheets and window vinyls, floor stickers, and we've put them all in a pack for you. We're also going to communicate to all the consumers out there that they need to look out for these type of signages when they're into a skin center to ensure that they visit a skin center that's clean. Okay. So as much as it is important to ensure that you display to the consumer that you've got a clean space to visit, it's also important to keep records and reports of what your spaces are looking like and are you managing it really well. So as you know, our concept stores have already opened for retail. And so we have tried and tested different types of reporting. And so we can actually give you all these checklists to help you to get your spaces ready and to maintain these guidelines. These checklists will be available on our online platform for you to download and customize the way you would need them. Your first checklist I want to talk about is your checklist post-lockdown. So this would be your very first checklist and cleaning that you will do before opening, because as you know, many of your spaces have stand still for a very long time, and we need to ensure that they are ready to open for business. So this literally covers everything that you need to know to open up, and you can have your manager or yourself sign this off to ensure that there's a double check that everything is ready. Of course, this then needs to be maintained. And I just love this daily cleaning checklist because it starts with opening checks to hourly checks. So it really gives you a great guideline for the therapist to just tick, yes, I am wearing my mask from home, I have sterilized my shoes, I've changed into my uniform, I'm wearing a mask, I've sanitized the alarm pan, my temperature was taken, etc. So you could go through these and you could definitely customize this additional to what you are doing in your skin center and also what your requirements are. You'll see it also then follows on the hour that these spaces needs to be cleaned. The next checklist is daily screening of our staff. So it is very important to ensure that you've got healthy employees coming to work and that there's no cross-infection between people. So this just talks to the therapist and the manager, whoever is in your space. The minute they've come in the morning, you've checked their temperature, but you've also checked in on any symptoms they might have. We also check in again in the afternoon by writing down the degrees Celsius that the temperature is and if they have any symptoms. And this ensures that we just are open about this and that we don't have a space where people are scared to say that they're not feeling very well. Should a staff member not feel very well, they immediately need to report to their manager that they're not feeling well, or your HR, whoever is in charge of this. We also need to trace our clients. This is very important. The reason to get the information of each client that has walked through our doors is, let's say, for example, one of your employees contract the virus. We would need to contact everybody that's been in contact with that person for the past 2 weeks and let them know that there is someone with COVID-19 that they've been in contact with. Now, using this checklist is really easy to know that these are the clients I need to contact. So we keep track of this on a daily basis. And then last not least is once a client has entered our spaces, we need to disinfect that entire area. So you would go ahead, should the client have been at the skin bar or your retail space and at the point of sale, both those areas would need to be disinfected once the client has left, and this would need to be documented that the area has been cleaned. And all of these documents should be printed and put into a file that you have with you as a COVID-19 file on a daily basis to ensure that we are compliant. I think it's really important that we comply, because should we not comply, we'll probably find that they'll close our spaces, and that's the last thing we want. We want to make sure that we can start trading and also doing services on our clients. And if we can show that we can do this in a retail environment, they'll definitely make sure that they'll open us sooner. As I mentioned earlier, all these checklists are available on the on our website to ensure that you can download these and you can customize them even. Now, I know that you have probably heard about our Clean Touch certification. You've probably attended the webinar. I just want to make sure that if you haven't or your therapist haven't, make sure you go through that and you go ahead and do your certification with assessment. We want you to have a certificate and we want you to display this in your skin center to showcase to our clients that we are Clean Touch certified. So what do I do when someone is contaminated at my work? What do I do if I'm running a skin center and all of a sudden your therapist comes in and they are found positive of COVID-19? Okay, so what's important is that you notify all the people that was in contact, your therapist as well as your clients. That's why those documents are so important. Those employees that was in contact with a person that's infected needs to be in self-isolation, and they would need to go to their local COVID testing center to get tested. You will need to deep clean completely your environment and disinfect it before you allow any staff to return, and then you can decide once that deep cleaning is done and you're 100% sure everything is clean, whether you're going to close your skin center or reopen it. That would be obviously up to you. Now, during this time, we've worked really hard as a team at Dermalogica to create a COVID-19 toolkit that would absolutely help you and assist you to reopen your business easily in a safe way with all the PPE and tools that you need in order to do that. This toolkit is in the process of finalization. So it's important when we go through this, I will showcase to you what we have in mind, that you get in contact with your BC and let them know what are the things that you will be interested in this toolkit, so that we can make sure that we bring you a toolkit that you would want to invest in to get your space ready. The PST Toolkit will consist at this stage of 3 reusable branded face masks. It will consist of 1 face shield, a branded reusable apron, and lots of collateral material, bed tents, window clings. Printable items will include, you saw those beautiful floor decals, window decals, skin bar decals, tent cards, etc. So there's a lot that goes into this toolkit, and we will also load this on our website. And you could definitely let your BC know what you would be interested in seeing in this toolkit. And we can then see how we can customize this for you and present you with the toolkit that you would want next Thursday when we meet here again. Where can I find all this information? I'm going to just take you through the screenshots where you can go online. So if you go to our website, dermalogica.co.za, and you go to For Professionals, where you would normally go, as you can see there, you would then click on the Business Owner Support, which is right at the top there. And in this folder, what you will see is a file that's called PPE Support. So in the PPE Support, in this file, we have lots of documents for you. The first document is this actual SOP, so where all the extracts from this PowerPoint, there's a detailed SOP that you could use and train your staff on. There's a file that's called PPE Gear, and in this PPE Gear, our team at head office have really done a lot of work in gathering different suppliers, comparing prices with quality of all the gear that you would need to open your spaces. And we've put them all inside this document, and you could research that and purchase anything that's not in your toolkit. And then you will see there's something called Protocols Checklist New, and this are all these checklists that I've just covered with you that we use within our concept stores. You could just download them and customize that for your specific skin center. Now this brings us to the end of our session. I hope you really enjoyed it. I haven't looked at the chat box with questions, but if we could just do some questions and answers right now, I'm happy to assist you in any way. I see they're all from Sadie, that she has put a link there for you where you would be able to get all the information that we just spoke about and where you would click on to get the PPE items. It's a pleasure. Elizabeth says, thanks, Sadie, for all the information there. So if there's any questions from anybody, you can just let me know.
Thanks, Ilse. Yeah, if there's anyone with questions, you're more than welcome to switch on your camera as well, and you can lift up their hand, and then we can take questions that way as well.
Yes, absolutely. I don't see any questions from anybody at this stage. It's a pleasure, Monica. Thank you for joining us. We have a question from Natalie.
Natalie Lopez. There's one from, which shoe coverage applied in Toolkit?
So, Natalie, this is quite a good question. We haven't explored shoe covers as it isn't a requirement to put shoe covers on. But I think this would be a great addition when we start performing services that we could do shoe covers. So this is definitely something we can research. So thank you for that suggestion. At this stage, we just spray with our sanitizer underneath the shoe. But a great suggestion. Let me just go again. Michelle says, thank you. It's a pleasure, Michelle. Pleasure, Elizabeth. Thanks for joining, Lana. Thanks, Debbie. Monica, thank you very much for joining. Are you aware the Department of Labour are doing COVID audits? So, Vanessa, we haven't come across an audit as such, and I'm not 100% sure on this, but I can definitely find out for you. I think what is important for us is that we comply in every single way that we can to ensure that should they audit us, that we are fully compliant. But I am not aware of any. Okay, so thank you, Elizabeth. You say that your husband's sourcing shoe and bed disposables. Well, let's say, you know, fantastic, because we do need disposables for the beds as well. Okay. Okay, Vanessa says they're definitely ordering in our area and ours is next week. Okay, so there we have it. They're definitely auditing, and so that's why these things are just so important, and also having your files ready and all compliant. Anything else from anybody else? Michelle is asking, what are they auditing? Vanessa, maybe if you know about the auditing, could you let us know if you know anything specific? Michelle, for us, if I look at what they're auditing, I know that they're going to look at your certification, if you are able to showcase that you're allowed to trade. They're going to look at your disinfection, like what are you using to disinfect, what are you using as your sterilizers, does your staff have the right PPE, are you doing temperature checks, where are you actually saving all this information, all these checklists, and then of course they will check your specific spaces and also make sure that you're not doing any services that's not allowed at this stage. So I'm assuming those are the things that they will look for. I don't know if there's anything else we want to add to that. Yeah, everything we covered today is what Vanessa is saying. Thank you, Vanessa. Okay, so I think if there's nothing else from anybody else, I think we could close off our session. Thank you so much for your time today. I really appreciate it, and I hope that you found it informative and that you know what exactly you need to do to get trading again, because we need that. We all need to get back to business. So thank you so much. And Ilse, if you want to close off, and I'll see you next week, Thursday. Same time, same place.
Perfect. Thanks so much again, Ilse. Really, really appreciated the informative session. And then, yeah, just thanks for everyone for joining. We'll definitely see you again next week. We have another session on Monday, 2 o'clock, and then Thursday we'll be seeing Ilse again as well. But yeah, thanks again. And if there's any questions, please feel free to let us know. You can either get in contact with your BC, and then we can take it further from there. But have a wonderful afternoon, everyone.
Awesome. Bye-bye.
Bye.